Today we are starting a series of video lectures on examination of the cranial nerve. So let us first start with the olfactory nerve, which is our first cranial nerve. On examination of this olfactory nerve, at first we have to inspect the nose for any deformity or rash present on the nose. If there is no deformity or rash present on the external appearance of the nose, then after that we have to inspect the vestibule of the patient for presence of any polyp growth inside the nose in the each nostril. After examining the vestibule of the patient, we shall proceed to examination of the smell in the patient. For examining the smell of the patient, we have to ask the patient to close the eyes and close one of the nostril. After closing one of the nostril, we have to then introduce the patient with certain type of familiar substance for the patient to smell it. And we should not use any ammonia like substance which can also irritate the sensory fiber of the trigeminal nerve and can falsely lead to a sense of smell. We can introduce some familiar substance like soap, agarbatti, etc. for testing the sense of the smell. So let us begin in examining the sense of the smell. নাক বন্ধ করা, চোখ বন্ধ করা। स्मेल मिल रहा है दूसरा नाक स्मेल मिल रहा है After testing the sense of the smell, we shall say that the patient has normal sense of smell. And after testing, if the patient complain of anosmia, there can be certain pathological condition linked to anosmia. The most common condition which can cause anosmia is the upper respiratory tract infection. Upper respiratory tract infection can cause anosmia in the patient. And as we know, the notorious upper respiratory tract infection in this era is the COVID-19 infection. COVID-19 infection is notorious for causing anosmia in the patient. The other condition which can lead to anosmia are the ethmoid tumor. Ethmoid tumor sometimes can cause anosmia in the patient, or meningioma of the olfactory bulb. Meningioma of the olfactory nerve can cause anosmia in the patient, and developing meningioma of the olfactory nerve can cause unilateral anosmia in a patient. So the process for unilateral anosmia is the developing meningioma in a patient of the olfactory nerve, and head trauma sometimes can cause unilateral anosmia in a patient. Head trauma without skull fracture can lead to unilateral anosmia in a patient. Ethmoid tumor can lead to anosmia in a patient of the olfactory nerve. So we must remember that while testing for the sense of smell or while examining the olfactory nerve, it is important not to introduce ammonia-like substance which can irritate the sensory fiber of the trigeminal nerve. Sometimes the patient of anosmia complains us of reduced taste. They doesn't complain us of anosmia, but they will complain us of reduced taste because smell and taste are linked together. If we cannot smell the food, we are definitely not going to taste it. So sometimes the patient will complain to us of reduced taste. So these are the important points related to examination of the olfactory nerve. On regarding the anatomy of the examining anatomy of the olfactory nerve, we have to remember that the sensory fiber of the olfactory nerve are present on the mucous membrane of the nostril, and this sensory fiber goes to the olfactory bulb. It pierces the cribriform plate of the ethmoid bone and reaches the olfactory bulb. From the olfactory bulb, it goes to the bitemporal region. So the sense of smell reaches to the temporal lobe of the brain. So if there is any pathology to the temporal lobe of the brain, or we are suspecting any pathology of the temporal lobe of the brain, then also it is important to test for the sense of smell. And during the course of this nerve, it passes through the frontal lobe to the inferior aspect of the frontal lobe. This nerve passes from olfactory bulb to the temporal lobe through the inferior inferior of the frontal lobe. So any pathology of the temporal lobe or frontal lobe, if we are suspecting, we should examine this nerve, this olfactory nerve, to test the sense of the smell.